most years we don't necessarily stress out quite as much, but this year in particular was an important year for us. If they didn't get their flu shot, we didn't see them at Christmas. So that was the rule, that they had to get their flu shot.
Yeah, the young lady you're listening to there, Katie, she says she got the flu shot while she was pregnant and reminded her family everybody needs to get the shot this year. In fact, flu cases are up in Oregon and in Washington. We're told 1 in 20 emergency room visits in Multnomah County related to the flu, which is up considerably over last year. And joining us now is Dr. Andy Barnett with Legacy Go Health Urgent Care. Doctor, good morning to you. So let me start. So we're saying the case of flu up. How about the number of people that actually got flu shots? Do you know, doctor, has that been the same this year over past years?
Yeah, so this year we are seeing very substantially increased numbers of influenza patients in all of our Legacy Go Health clinics across the entire market, as well as in emergency departments, much higher than we've seen in previous years.
Now, but what about are you seeing the trends of steady in terms of the amount of people that got a flu shot? I'm wondering if not as many people got a flu shot, now we have a problem.
Yeah, so it turns out that this year's flu shot was very good for influenza B, so we are not seeing a lot of patients with influenza B who had the flu shot. Unfortunately, as I've talked about previously on the show, the influenza A portion of the flu shot did not work very well this year. It was just bad luck, unfortunately. And so we are seeing huge numbers of patients with influenza A, even those who had the flu shot. So the flu shot was good for part of the flu that we see. It was not good for the other part of the flu this year.
So Dr. Barnett, take us through the warning signs where myself at home, when do I know, well, this is not something I should just try to get through. I need to actually go see my doctor.
Yeah, one of the most important indicators that what you have is true influenza is a fever. So if you don't have a thermometer at home, now's the time to go out and get one. For patients who have true influenza, they tend to have a fever upwards of 101 or higher. Wow. It also is usually accompanied by a cough and really profound fatigue, malaise, and joint aches. Those would be the indicators that you have true influenza. And while there's not a lot that we can do for most patients with influenza, for those who are very old, very young, or pregnant women, we do have medications that we treat with to try and reduce the overall risk of influenza. As well as that, patients can develop a different kind of pneumonia when they have the flu. And we need to think about that and evaluate patients for that if they're sick.
So you mentioned the different strain of the flu this year. Is there something I can do and be proactive that'll keep me a little bit more healthy, if you will?
Yeah, it's really important. Lots of hand washing. If you have a cough, cover your cough. Try and avoid people who have influenza. If they're known to have influenza, they should stay home from work. And if you haven't already gotten your flu shot, please do go out and get a flu shot. Even though it's not great for influenza A, it's great for influenza B. You can stop in at any Legacy Go Health clinic, get your flu shot right there on the spot.
And Dr. Barnett, one more question, and I think we actually talked about this on the show earlier too, but what about loading up on vitamin C or things that a lot of people do to kind of keep themselves ahead of the game? Any recommendations there, or it simply doesn't matter?
You know, I'll tell you, Rod, I personally take a vitamin C supplement every morning. I like to put a little bit of it in some water and take my vitamin C. I think it makes me feel better. There's not a lot of really hard scientific evidence to support it, but if it makes you feel better and gets you drinking more fluids, it's probably not a bad idea.
All right, Dr. Andy Barnett with Legacy Go Health Urgent Care. Thank you. Good health to you the rest of this winter season, Doctor.
Thanks. It was a pleasure.